Hi, my name is Sean Griffin, and I'm here to present Project Domino, Citizen Data Science Against COVID Misinformation. In disasters currently and past disasters, misinformation and the rumor mill has been rampant, leading people down the wrong path, unfortunately, to severe injury and or death. And this is no different in the current pandemic that we're all experiencing, continue to experience in COVID-19. I'm Sean Griffin, I'm the Chief Executive Officer and co-founder of Disaster Tech, a public benefit company that sits at the intersection of data science and decision science, building custom tools and software for disaster management. I'm also a U.S. Navy veteran, and I spent 15 years in federal service, most recently at the U.S. Department of Energy, where I served on spending millions of dollars at the national labs to solve complex national security and energy resilience issues, as well as working in real-time disasters, such as the hurricanes Irma and Maria response, chairing a crisis action planning team for power restoration in Puerto Rico and the Virgin Islands. I also served on White House staff as the Director for Incident Management Integration Policy on the National Security Council under Presidents Obama and President Trump, leading the disaster management portfolio for senior White House officials and the cabinet. Everything from floods to wildfires to pipeline breaks and nightclub shootings. So this article was very appropriate for our presentation today, talking about misinformation on the internet. Why can't Facebook fix itself? The platform is overrun with hate speech and disinformation. Does it actually want to solve the problem? And the answer is no, because Facebook's business model is to increase your ability to see more content. It doesn't matter what the content is. It could be Nazis, it could be hate speech, it could be medical misinformation in COVID. The platform is not incentivized. And also, it's extremely complex and complicated. Even with the most robust algorithms and the ability of humans to filter through content, there's just too much being shared on the platform. And frankly, Wild Wild West, it is unregulated. And Silicon Valley is self-regulating itself where it just doesn't have the tools nor the incentive to do so. The international community has to rally together, as well as nation states, to stop misinformation and hold social media companies accountable for misinformation and disinformation that has led to injury and illness, as well as death. Here's an example of Governor Stitt, Kevin Stitt from Oklahoma. As you can see, the date of this tweet that he released with his family wearing no masks in early March of this year, as the pandemic was really taking a foothold in the United States. You'll see that Governor Kevin Stitt tested positive for COVID-19 shortly thereafter. And as a result, because of the delay of government, both at the federal level as well as the state and local level, to contain and to mitigate infection, to mitigate the spread of COVID-19, the epicurve spikes up with cases, in this case, July 27th, over 1,401 positive cases on that singular day. And we've lost mask and distancing initiatives in March, and we still need to win it. As you can see, the peak in people researching masks on the internet, this is Google search, peaked in March, really when the pandemic was ramping up, and it's slowly gone down since then. In many cases, because of disinformation and misinformation spreading on the internet, people are shying away from masks, believing that masks do not provide the level of protection that we do know that it does, given the science coming from the Center for Disease Control and Prevention or the World Health Organization. And frankly, our governments and international institutions have done not as well at being consistent with authoritative guidance on what to do relative to masks, social distancing, therapeutics, medical countermeasures, and so forth. We are, talking about the curve, we are behind the curve, and the only curve that's increasing is the number of infections and deaths around the world. And we're also losing the vaccine battle before any are even approved. As you can see, given this recent Pew Research Center study, In May of this year, of all adults, 72% believed that they would get the vaccine, definitely, and a 42% or 30 probably. But since then, now, or just recently in September, only 51%, 51% of the population in the United States would confidently either definitely or probably get the vaccine. And in some cases, 49% would not. As this goes on, and if as more people become less confident in a vaccine that would be released, it's going to be harder to defeat this pandemic and get back to life really in this new normal of which we know it. And I think this was probably the most important quote back in January, where we're still in the middle of an epidemic, a global epidemic. We're fighting an infodemic as well, the Director General of the World Health Organization claimed at the time. So in order for us to change our behavior and swing the tide, shift the tide, and turn this aircraft carrier that's a pandemic in the right direction, we have to battle misinformation on the internet in our communities. So just as a quick disclosure, we are all volunteers on Project Domino, and I'll talk more about the project in addition to the background and why we're doing this. We have been directly impacted by COVID, whether we've had, in my case, family members die from COVID-19, or we've seen our friends and family at the front lines of fighting this horrible pandemic. As a disclaimer, we are nonpartisan. We are not looking at this from one political party or the other. As I mentioned earlier, I was a career civil servant serving under two presidents, both the Republican and Democrat. This is not an issue of politics. This is an issue of both public health and safety, as well as national security. We have to be able to get ahead of this because our economy is affected, our way of life is affected, and it's not only just the public health effects, it's also, women are dropping out of work because they can't handle to manage the load of dealing with having children versus dealing with their everyday tasks. And we can't let this happen anymore. And the election in the United States is only amplifying and making things worse because as folks think that their voter fraud is real and that their votes aren't going to be counted or the wrong votes are going to be counted, that only adds to the noise on the internet of misinformation, whether it's related to the election or medical misinformation on COVID. And as you can see, I want to point out some key individuals and groups that have been instrumental since day one when we started this project back in late February. Leo Mayorkovich, he is the CEO of Graphistry. Myself, Anita Nikolic, who is a professor at the University of Illinois, and Cody Webb. These folks have been really at the forefront of what we've been doing. Doyle Groves, who's been working with us at Indiana University, has been just tremendous, and everyone involved. We couldn't do this without our support from companies like Neo4j and Microsoft and Google. We've had some really incredible support, NSF as well, through the Chameleon Project. So where are we at today? Down the rabbit hole of COVID misinformation, the perspective of the landscape, as well as filling the systematic gap with open citizen science, open data science. So what we can do as individuals, both at home in our communities, as well as in government and in business. Project Domino, from its beginning, and it will as it sustains, be an open project so that we can bring folks from around the world to participate and to contribute to our efforts on fighting misinformation, medical misinformation related to COVID-19. So many folks may be familiar with Dr. Sherry Tenpenny. She has been at the center of the anti-vaccine movement around the world. Her speeches have been banned. She's been kicked out of conferences. And you may have been familiar with this woman as well, Judy A. Mikovits, who Twitter is recommending that you follow. So if you follow Dr. Sherry Tenpenny, who's spreading misinformation about anti-vaccines or vaccine misinformation, it's also recommending that you follow another person that's been spreading misinformation on the internet. And just click through this real quick. Um, Coming back to this, I wanted to point out that Judy, you may have noticed her name. She was associated with the pandemic video. And even though the video has come down off of YouTube back when it was released, I believe in the early spring, uh, we're still, Twitter is still recommending that you follow her if you're interested in Dr. Sherry Tenpenny. So it creates this echo chamber on the internet. And as more people follow her and the other woman, you'll notice that there's this amplifying effect. This is why we call it Project Domino, because it's a domino effect. As more misinformation gets spread, the more retweets, the likes, amping up the visibility of it. Again, the business model with ad tech and with platforms like Twitter and Facebook, their interest is ad revenue. And it doesn't matter how the ad revenue is maintained or obtained. All that matters is that you click and they get paid. Doesn't matter if that's through the proliferation of hate speech or anti-misinformation or anti-vaccine information. They do not have the incentive to downtrend this information on the internet. So what we're seeing here is, because of our work that we've done with companies like Graphistry and Social Forensics, we're using a graph database and graph visualizations to showcase the various relationships and connections between the Dr. Busy T, who's an anti-vaxxer, as well as with other groups who are spreading this information on the internet. And what you're seeing in the blue is the connection between the anti-vax and natural medicine community, whereas the red dots just demonstrate connections between people who are associated or affiliated with the Trump administration or the Trump campaign. And then as you get down into this green, you get to the MAGA groups, the QAnon, the UFOs, the more alt-right or extreme right communities on the internet who are spreading misinformation. But as you can see, this network and weaving of individuals and connections are tightly coupled across these various communities. And misinformers, share influence outside of their real network. As you can see, these networks are closely coupled together, tightly coupled together, but then you have information spreading throughout the entire network. It can't be underscored enough the fact that when you have this echo chamber of information, I like to say the analogy of, you have one person on the street looking up at the plane. Most people walk by and think nothing of it. They don't look up. Once you have 2 to 3 to 4 people start looking up at the plane in the sky, there's multiple forms of validation. So from a psychology perspective, you might be inclined, in many cases are inclined, to look up at the sky to see what is up there if multiple people are looking at it, because it's your own safety, your own well-being that you're concerned about. And the same is true, same effect on the internet, where you have the amplifying effect and more people are following it, more people are looking at it, which then pulls you in to the rabbit hole of looking at that. And then you start to vector off and get even more extreme. YouTube's algorithms promote more extreme behavior as you look at different content on the internet. So some of the things that we've done, and just to kind of go into the more technical side of the data science, we're using neural networks and graph analytics to both visualize and understand, where the needles in the haystack are, right? Finding out who is really spreading this misinformation, and how can we find different clusters of correlated information, like, for example, the hashtag Wuhan virus, or anti-vax, or MAGA, or QAnon. When you start to see these close correlations, it's clearly evident who is spreading the misinformation, even though if we handed this to the large platforms, they're less likely or not likely to do anything about it because of their incentives and ad revenue. So just some of the statistics, taking this graph by itself: 100 million COVID tweets scanned, 5,000 accounts used, plus over 3 or more flagged hashtags. So things like Wuhan virus or China virus, for example. 97,000 similar hashtag intensities. And this is how we start to couple things together. Again, the pandemic. Even though the video was taken offline, the more this echo chamber, her regular tweets where she's talking about the content of the pandemic, the video can be taken down, but the information, the misinformation, and the disinformation is still spreading through these Twitter accounts and various other social media platforms on the internet. So it's clear, right? The misinformers, it's blatant. They are doing this intentionally. Why? Well, they have a number of reasons. They want the validity, they want the fame, they want people to go to their website and buy, trinkets and merch and all these other things. I mean, the ultimate thing is that they're going to do it. They may have various, reasons on their own incentive, but the fact is it's happening and it's rampant. They have clear systemic support, right? Including the mainstream media and elected officials pushing misinformation by sending the retweet and then further validating in people's minds that this is appropriate or authoritative information. If this keeps happening, we're never going to get ahead of the curve of the pandemic and more people are going to die. So we talk about the threat model, right? Attacker models, the modern digital marketing, and then confusion and radicalization. We can look at the radicalization methods and processes that are leveraged in terrorism campaigns, in terrorism recruitment. The same is true. In this case, we're looking at it from a medical misinformation perspective. But the procedures, the tactics, the processes, the protocols, the operations that these folks take are no different than, say, ISIS or Al Qaeda. But in this case, we're talking about medical information or misinformation related to our election campaigns. It doesn't have to be large state actors. It could just be tightly coupled, loose networks of communities that come together that are creating this echo chamber on the internet, but using traditional methods from terrorism groups, for example. We noticed that the reason why the goals of the attackers are varied. Some of it's to confuse, which is much easier, to inform, confusion, to continue to confuse, or on the much more harder side, which is to radicalize, right? So for our goals as Project Domino to reduce misinformation or disinformation on the internet, it is much easier to inform communities to say, hey, this is bad information, don't follow it. But once you start to get into the radicalization side, where people start to believe in it, it becomes part of their own ethos. They start to identify, it becomes part of their identity. That is much harder to really fight and to deal with. But the bottom line is, the more that we can get ahead of the curve by stopping misinformation on the internet, stopping misinformation and disinformation in our communities, we can stop them from moving from being confused to radicalization. So systemic corruption, right? Misinformers, evil, the fringe, opportunists, right? Who are opportunistic. Again, somebody might just be bored, out of work, underemployed, unemployed. They're on the internet. They have nothing better to do, or they're part of a much more tightly coupled, organized system that is deliberately trying to confuse and disrupt people's knowledge of information and leading them down the wrong path. Just like with the voter fraud issue, right? If we continuously create this echo chamber and narrative of voter fraud, that might disincentivize or stop people from going to the polls or undermine our democracy with respect to the U.S. elections. But the same is true with medical misinformation, where the more confusion, the more disinformation, the less likely that people are going to believe authoritative sources, whether it's the World Health Organization or the Center for Disease Control or Health and Human Services or the White House Task Force or whomever it is that's supposed to be, quote, authoritative, state public officials, health public officials, and so forth. The ability of these authoritative sources to convince people that they should wear masks, that they should physically distance themselves from others, that they shouldn't go out into crowded spaces or go to the bar and sit at the bar. in order for us to get ahead of this, we need people to believe, we need behavior change. And it makes it incredibly difficult when these internet platforms not only allow the spread of misinformation, but amplify it because their business model matches that incentive. The ecosystem is fractured. We have no cohesion on how do we deal with the policy, how do we deal with the systemic issue of misinformation. In academic circles, we're writing papers, but that's not transforming or translating into policy. Civic groups are not tightly coupled with journalists. So we have this fractured ecosystem of people who are involved in misinformation or fighting misinformation, but there's no cohesive, organized effort between government, academia, media, corporate entities to fight this in a cohesive way. But we need it to happen, and we need it to happen now. And this is a different kind of organization. Rather than going to the big tech platforms, or rather than going to the government to push the rock up the hill, we specifically created Project Domino to make it as an open source, grassroots data science effort that we can pull as many people as possible together to solve this as a community. We like to say in disaster management, it takes a community, a whole of community, to respond together, from local leaders, from faith-based organizations, community-based organizations, from governments and so forth. We need everybody to come together, but this can't be behind a firewall. This can't be behind a closed door. We're working in the White House Situation Room. That has its purpose in life. But we're talking about a global network of social information, social media platforms that we really need folks to come together and to contribute to this project and downtrend, but most importantly, intervene in communities in order to stop the flow of misinformation. We've done this with unbelievable partners. We're standing on the shoulders of giants in the open source software community, such as Google, NVIDIA. We're using Rapids, which is a new data framework and GPU data framework in order to leverage GPUs, graphics processing units, through NVIDIA to do data science at scale using open source software. Of course, our company, Disaster Tech, Streamlit, Neo4j, using Jupyter Notebooks, which are widely accessible and widely used in the data science community. Being able to visualize and to understand and to interrogate the data to best see where the misinformation is happening, so that we can then transition and translate that into interventions so that communities can quickly understand and consume our analysis, to be reporting it in the media, to be reporting it locally, to stop the spread of misinformation, to protect their communities so we can reduce infections and end this pandemic once and for all. As you can see, we're bringing in millions and millions and millions of tweets per day in the milliseconds. So the more information we can pull in, the more information we can pull in at scale, it allows us to really understand the needle in the haystack. But unfortunately, when you're pulling in Twitter data, for example, you're drinking through a straw, because the API that's available through Twitter does not allow you to look at every single tweet on the internet, which is why we have to consistently be pulling from Twitter's API to get more data and more data and more data in a much more rapid pace. And we have to do it at scale so we can get as much as possible that we can get our hands around, wrap our hands around, so that way we can really sift through the haystack, find the needles within them, and then start to identify who are these bad actors, what information or misinformation are they spreading, and let's do something about it to stop the spread. We're using modern artificial intelligence, from hashtag analytics to deep natural language processing. And again, because we're doing this with open source tools, even 5 years ago, this may not have been possible. 10 years ago, this may not have been possible. We're using bleeding edge technology to get to the heart of this, and to really look at scale where the misinformation is happening. So again, we can create those interventions to stop the spread. So we came up with this acronym: Signal, Map, Alert, Track, and Recruit, Recruit and Track. So the first thing is we need to infer or understand what the topics are spreading on the internet, right? Don't wear a mask, don't believe in the vaccine, and so forth. We need to find where the misinformation is happening. We need to understand what communities are being impacted by the misinformation, being able to track those communities and see where that misinformation is being targeted. Then we want to alert, allow interveners, allow interventions to make aware to these communities. Hey, you saw this post, you saw this video on the pandemic, or the person who created the pandemic video, or the folks that are highlighted in that video. Don't follow their information because they're deliberately trying to mislead you and bring you down the wrong path. You need to follow this guidance, right? Recruit, prioritize influencers. You certainly have the large influencers, whether it's the Taylor Swifts or the famous actors, but you have community influencers. You have mayors, you have pastors in your church. You have folks at a very local level who are very influential, who are part of that social cohesion, and then be able to track the success of the campaign. Of course, we can't make this better if we don't measure it, if we don't track it, we don't understand how we're doing, how we need to improve, so we can, of course, ensure that our interventions are best as possible. And we don't have to reinvent the wheel. We can use like the AIDS campaign, for example, which was very successful when you're working in the local bars and the local clubs to inform communities about the risks of AIDS, of the risks of unsafe sex and unprotected sex, and how that can lead to spreading HIV and the AIDS and causing the AIDS epidemic to get even worse. There are case studies and science that prove there's ways to do this. But in order for us to intervene, we really have to understand what's going on the internet, and we've been doing that. And this is why with Project Domino, we've been shifting from investigation to intervention. So on closing thoughts, number one, misinformation is manageable. But the problem is that, of course, we have companies who are complicit in targeting ads where misinformation is spreading, because that's their business model and that's their incentive. And there are coordinated cases that are big, blatant, and detectable. But the bottom line, just like the pandemic itself, this is preventable. We can prevent the spread of misinformation on the internet. There are key groups, social media, tech, ad tech, political parties. We need to put pressure on these key groups so that we can stop the spread once and for all. And using open citizen science, open data science to really get ahead of this, because at the end of the day, we're talking about massive political machines, massive corporate machines that not only don't have the incentive, but in many cases work off one another, where you have large tech companies in the back pockets of regulators and legislators. Unfortunately, unless we have the people, the many people, remember, we vote them in, we're bigger than them. We outnumber them. There's more people than there are legislators. We need the people to get behind it as a rallying call to stop this from happening, which is why we've taken an open data science, an open citizen science approach to this problem, because we knew we were going on a David and Goliath type of match, and it's mismatched. And in order for us, whether it's, you look at issues of social justice or inequities in the world, where we've been able to create the most headway is when the people rise up and do something about it. And this is true on medical misinformation. So if you want to get involved, swing by projectdomino.org. We have an active Slack channel. We have over 100 people from around the world contributing to the project to date. And we're looking for help with coding. So if you're competent in Python, a lot of our work is being done in Python, in JavaScript, modern languages and libraries. Look for partnering. We would love to partner with nonprofit organizations, community organizations, faith-based organizations, to really start to build interventions in local communities to stop this spread. And of course, sponsorship. This is completely free. We are doing this really because, again, our families are affected, our neighbors are affected. We want to stop the spread of misinformation on the internet, whether it's for COVID-19, or other disasters, a hurricane, earthquakes, and so forth. Misinformation, disinformation, disaster is not germane or specific or unique to COVID-19. This just happens to be one specific problem that we're all experiencing ubiquitously across the world. And I want to showcase, sort of the trifecta of how we will advance our intervention. Number one, we need funding for this project. Number two, we need volunteers and resources. And lastly, we need the policy and the regulation to change. So we're hopeful through our efforts in volunteering, by pulling people together into Project Domino and funding to support. We're all working day jobs. In my case, running a company full time. This is very difficult to be able to balance. I have children at home. Like we're all experiencing the pandemic. We're all trying to do as much as we can, just like with this workshop through the Complexity Weekend, where we're trying to volunteer our time because of the importance of the issues around COVID-19 and this pandemic, which has no end in sight, at least no foreseeable end in sight until a vaccine is available, and we can start to see the numbers dip below the 3 to 2% per Johns Hopkins University, for example. We need the funding, we need the resources, and we need the legislators and policymakers to make a change because we can't sustain in the current environment. So with that, I'll thank you for attending my presentation. And again, I implore you to come to projectdomino.org. I also ask you to visit our website, disastertech.com, and check out what we're doing. You can also email us at community@disastertech.com. We'd love to get you involved with what we're doing at Disaster Tech beyond Project Domino. And again, appreciate your time.